Hey guys, welcome back. I'm Heather Hutchison, and this is our community that we're building for those of us who have a loved one who struggles with any sort of mental illness or has mental health struggles. And we are here to share resources and encouragement and answer questions and just be able to keep talking and having the conversation about mental illness and what it's like to live with it and what it's like to live with a family member or a loved one or a friend who has it. So I'm so glad you're here because you are the reason that I'm doing this. I hope you will share it with your friends, family, teachers, your clinicians, whoever is involved at all in your life that's related to mental health and mental wellness. So I'm glad you're here. Today, I wanted to talk about something that is often shared with me. People reach out to me and have a frustration with this issue, and I've experienced frustration with this issue as well, and I want to maybe bring it out into the open and maybe clear up some confusion and educate a little bit. Those would be my cockatiels in the background, adding a little ambiance to my video. Anyway, I want to be able to talk about it and for you to maybe go away with the understanding that some of what you're experiencing is probably pretty normal, even if it's frustrating. And that issue is a lot of people reach out to me and say that they have either one, tried to get an appointment with a psychiatrist only to find out that the waiting list is really long, or secondly, that they've gone and seen a psychiatrist and maybe got prescriptions or whatever, but kind of felt like they were rushed out the door, that their appointment was only a few minutes long, and they felt maybe dismissed, and they were kind of surprised and shocked that they didn't get more time with the psychiatrist. So I wanted to talk to you about that because that is completely normal here in the United States. It's not my favorite. I don't love it. No offense to all you incredible psychiatrists out there. We have a huge deficit for psychiatry in this country, and especially when you go into pediatric psychiatry, there's really a deficit. So I know that there is a huge need, and the need is overwhelming for what the providers that we have. So I get that for the whole waiting list thing. But the thing that you need to understand about psychiatry is that psychiatrists are medical doctors, and their purpose is essentially to prescribe medications and to do medication management for mental illness and things related to your mental health and your mental well-being. So they're not counselors. They're not psychologists, which is a whole different brand. Psychologists are not medical doctors, and they do more on testing and evaluating and counseling side. The psychiatrists are solely there to look at your history, to look at your medical history, and to see if there are any chemicals that could help you to feel better and to show up better in your life. So, no, your psychiatrist is not blowing you off. Obviously, there are always the bad apple, and there may be somebody who really is blowing you off, but you probably can tell the difference. And they're not ignoring you. They see a lot of appointments and a lot of patients throughout the day. And I mean, I've been in appointments with my son where we were there 5 minutes or less, and it can be very frustrating. And I get it. And it's hard when you go in, you pay your $50 copay, and you feel like that you're going to walk away with maybe this I don't know, silver bullet that's going to solve what's going on, and it doesn't happen, and you're disappointed. So a couple of things that I want you to keep in mind that you can do is this. So number one, if you can kind of collect your thoughts or your questions or kind of evaluate where you are, if you're the one who's struggling or your loved one is before the appointment, that would be best. Because what happened with us, and I think what happens with a lot of people, is once you get to the place where you're like, okay, that's it, I'm going to make an appointment with a psychiatrist, you start to feel like I need to have that appointment now. So when you call and you make the appointment and you're told you have a 3-month wait, that can be incredibly discouraging. Don't cancel the appointment. You can continue to call around and try to find someone else who can take you sooner, but don't cancel it. You'll just fall down to the bottom of the list again. So that's the first one, is I totally and completely get that once you're in the place where you're vulnerable enough that you're ready to see a doctor and possibly try medication for the first time or return to medication, that you're ready to get going. And that's incredibly frustrating. And just so you know, If you or your loved one is in a situation where you know that you need to see a psychiatrist and you're told you have a long wait and things keep deteriorating, you need to go to the ER. That will shuttle you through the process a little bit faster. And you just need to be aware of that. So that is an issue that we face here in the United States. Number two is know that you're not going there for counseling. And I totally get this because you feel like, we're finally at the place where either, my spouse or my mother or my child or myself, friend, whatever, is ready to go see this doctor, and we're in a vulnerable place. And then you're told to wait, and it's kind of scary to think that maybe that vulnerability will subside during the wait time. And trust me, it can sometimes. There can be an opportunity where you get the appointment and a couple of months go by and the patient then feels like that he or she is doing okay. And that can be discouraging. Be aware of that. Maybe have some conversations through the wait time of, remember how you were feeling, we still need to be evaluated, whatever. Also, you need to be aware that as vulnerable as you are, it's not going to be a counseling session. So a lot of us go in there with these like jumbled emotions, and we feel like we're ready to kind of explain why we're there. And, I've been feeling this, and I've been observing this, and this has been really hard. And you may be asked some of those questions, but a lot of the questions they're going to ask you are going to be pretty clinical. It's going to be diet. It's going to be mood. It's going to be symptoms. It's probably going to be family history. If there's any mental illness in your family history, it's not going to be, so what brings you in today? How are you feeling? And it's hard for you to collect your thoughts if you're not prepared for that before you go in. So if you can just kind of think about the reasons that you decided to go in the first place, and kind of have that, even take notes if you need to, have that clearly at the forefront of your mind, either as the caretaker or as yourself, then that's going to be the most beneficial to you, and that will help your doctor effectively figure out what needs to be done. Another thing that you can do is this. If you're the patient, I really highly suggest that you bring someone with you who's close to you, who can kind of help be an advocate and help you with maybe things that you might have missed. If you're not the patient, if you're a caretaker, then your job is going to be equally as difficult as the patient's, because especially with our children or someone that we love, when you're asked kind of what are the behaviors that you've been seeing, and you have to be really honest in front of that person. And if that person is not in a stable place at the moment, it can feel really crummy to try to explain that there's been aggression or name calling or violence or theft or lying or too much sleeping or self-harm or any of those things when you're sitting right next to this person that you love incredibly. And it can feel like you're telling on them. When Samuel was small, we started seeing psychiatrists when he was 3 years old. And we've been seeing them ever since. And that's been one of the toughest pieces of his treatment for me, is to be able to articulate what I need to say to the doctor while he's in the room without completely destroying his self-image or making him think that he's a bad person, because none of those symptoms that he's experiencing define him. They're all as a result of chemical issues that we've been able to get a handle on with the right cocktail of medicine. But the longer we've gone and the older he's gotten and the more self-aware he's become, he's been more honest in the last few years. And that really does help the doctor get the right treatment for you. So that's crucial. And if you're the patient, if you can ask someone who's close to you, like, what have you seen recently in me, and you can be open and not be offended with them saying, I felt like you were doing really good, but it seems like you've been in a big slump lately, or, I've noticed that you've been going out more, or I noticed that you've missed a lot of days of school, or it seems like you've been really agitated. To not take that personally, to know that they're on your side and they're telling you this because they love you, and those details are going to be exactly what the doctor needs to hear to help treat you effectively. So those are some things that you can do as a patient or as a caretaker. You need to be really honest. You need to be really open with compassion and grace, and know that you're not going to have a chunk of time. I think that the private owned practices are ones that you're probably going to be shuffled through faster, just because, they file insurance and all that. And it just is the way that it is. I don't have anything against psychiatrists. We need them desperately. but it can be frustrating to feel like you're kind of shuttled through. When we've had psychiatrists through our community services board, we've had appointments before that have lasted an hour. They've gone way more in depth, which has been really amazing. But those doctors are working on salary, and so the environment is a little different. So please just know, if you're in there for 10 minutes or 7 minutes or 4 minutes, you can stop and say, you know, hey, I had a question. But it'll help if you're aware of this ahead of time, that your appointment is probably going to be short, and maybe you need to have an index card of some questions so that you don't forget. Because even myself, I go to see my regular doctor and I have this long list of things I want to talk about, and when they're done and they leave, they had forgotten all of it. So just be prepared. Know that that's what you might face. Don't go searching for another doctor right away because you feel like that they pushed you off. I promise you that they didn't. But do make sure you find someone who fits you. Don't cancel your appointment because you find out it's a 3-month wait. That's very common. Continue to call around, and just know that their goal is to bring you to a place of stability, usually through medication. They're not going to provide counseling. That's a whole other piece, and we'll talk about all that stuff on another video. But I just want to let you know that there's nothing wrong with you. They're not ignoring you. They hear all these stories. They're listening for certain clues, for certain keywords. They have the skills to understand kind of how the chemicals work together to possibly even create a cocktail for you. So just rest easy. Know that this is the way that it is, for better or for worse. Don't give it any more anxious thoughts, and make the most of your appointment with your psychiatrist, because you and he or she are going to have to work as a team and work together so that you or your loved one can get the best treatment and live the best life that they possibly can. So like me below, share with everyone that you know who needs to see this, and keep coming back because we're going to do more videos about different kinds of therapists and doctors and what you might need or what you might not need. And we're going to start just really untangling this mess that maybe has you overwhelmed right now. So I'm so glad you're here. Please come back, and thank you so much. Bye.